Hi viewers, in this video we will discuss about Chapter 13 ICD changes. Chapter 13 is Diseases of the Musculoskeletal System and Connective Tissue. The code category is from M00 to M99. Coming to the changes. New codes have been added for intervertebral annulus fibrosis defect and muscle wasting and atrophy of the back. Slipped upper femoral epiphysis codes have been revised and new codes have been added to include the stability of the slip. And chest fractures associated with chest compression and cardiopulmonary resuscitation, new codes have been added. Coming to the intervertebral annulus fibrosis defect. Intervertebral disc is the cartilaginous structure separating two adjacent vertebra and is comprised of three interconnecting structures. They are nucleus pulposus, annulus fibrosus and end plates. Annulus fibrosus is a fibrocartilaginous tissue consisting of layers of lamellae rich in biologicals. They are useful for intervertebral disc regeneration and repair. The defects in annulus fibrosus of intervertebral disc allow nucleus pulposus tissue to herniate and causes pain disability. Microdiscectomy procedures remove the herniated tissue fragments, but unherniated or unrepaired defects remain, allowing reherniation or the progressive degeneration. Injured disc showed a progressive disc space narrowing with significant disc degeneration and proteoglycan loss. In annular defects, the nerve fibers were found to be distributed along the small fissures within the fibrocartilaginous-like tissue that filled with annulus fibrosis. Coming to the codes. For lumbar region, for unspecified defect size, the code is M51.A0. For small defect, the size is M51.A1. For large defect, the size is M51.A2. For lumbosacral region, for unspecified size of the defect, the code is M51.83. For small defect, the code is M51.A4, and for large defect, the size is M51.A5. Coming to the muscle wasting and atrophy. The muscle wasting is the decrease in the size and wasting of the muscle tissue. The muscles that lose their nerve supply and can atrophy and simply waste away. The people may lose 20 to 40% of their muscles and along with it their strength as they age. The main cause of the muscle wasting is lack of physical activity. It can be caused by the diseases of muscles and neurogenic conditions. Coming to the new codes. For the back region, for cervical region, the code is M62.5A0. For thoracic region, the code is M62.5A1. For lumbosacral region, the code is M62.5A2. For unspecified level of the back, the code is M62.5A3. Next one is slipped upper femoral epiphysis. Usually it occurs in teens and preteens who are still growing. The ball at the head of the femur. The ball at the head of the femur slips off the neck of the bone in a backward direction. It causes the pain and stiffness and instability of the affected hip. The hip is a ball and socket joint. The socket is formed by the acetabulum. that is a large pelvic bone, and the ball is formed by the head of the femur, which is the upper end of the femur. Like the other long bones in the body, the femur will not grow from the center outward. Instead, the growth occurs at each end of the bone, around the area of developing cartilage, that is called growth plates. The growth plates are located between the widened part of the shaft of the bone, that is metaphysis, and the end of the bone, that is epiphysis. The epiphysis at the upper end of the femur is the growth center that eventually becomes a femoral head. There are two types of the slipped femoral epiphysis. They are the stable and unstable. Coming to the stable, the patient is able to put weight on the affected hip either with or without crutches. Most cases are the stable slips. Coming to the unstable, this is a more severe slip. The patient cannot put weight on their hip even with the crutches. Here you can see more severe slipped femoral epiphysis, and it requires immediate urgent treatment. While coding this slipped upper femoral epiphysis, we have to check the below points. The first one is whether it is acute, chronic or acute on chronic. The second one is the stability, whether it is a stable slip or unstable slip or unspecified stability. The third one is the laterality, whether it is right, left, bilateral or unspecified. Coming to the codes. In 2022, we have only 9 codes. They are for acute, chronic and acute and chronic. For right, left and unspecified laterality. These codes are revised and the term stable has been added for these codes, and in 2023 for bilateral hip codes are also added. Till now we have reported the bilateral condition with 2 codes, both right and left slipped femoral epiphysis, and from now onwards we have to report the bilateral condition with the bilateral code. Do not assign 2 individual codes. And the new codes have been added for unstable slips and unspecified stability. Coming to the codes. For unspecified bilateral, the new code has been added, that is M93.004. For acute stable, the code is right hip M93.011. For left hip M93.012. For unspecified hip M93.013 and bilateral hip M93.014. For chronic stable, right hip, the code is M93.021. Left hip M93.022 and unspecified hip M93.023 and bilateral hip M93.024. Acute and chronic stable, the right hip, the code is M93.031, left hip it is M93.032 and unspecified hip M93.033, bilateral hip it is M93.034. Acute unstable, the new codes, these are new codes, that is M93.041 for right hip, 042 for left hip, 043 for unspecified hip and 044 for bilateral hip. Acute on chronic unstable, M93.051 for right hip and 052 for left hip and 053 for unspecified hip and bilateral 054. Unspecified stability, it is M93.061 For right hip 93.062, for left hip unspecified hip 063, bilateral 064. Acute and chronic unspecified stability. For right hip the code is 071, left it is 072, unspecified stability unspecified hip 073 and bilateral 074. If you observe the codes, the sixth character 1 or 2 or 3 or 4 indicates the laterality. For right it is 1, left it is 2, 3 is unspecified, bilateral is 4. Coming to the fifth character, 1 indicates acute stable, 2 indicates chronic stable, 3 indicates acute and chronic stable, 4 indicates acute unstable, 5 indicates acute and chronic unstable, 6 indicates unspecified stability, 7th indicates acute and chronic unspecified stability. So assign appropriate code, check the stability and laterality and the severity of the condition. Coming to the next one is fractures associated with chest compression and cardiopulmonary resuscitation. Usually chest fractures like sternum fracture, rib fractures associated with chest compression and cardiopulmonary resuscitation. Hence new codes have been added to report this condition. For sternum fracture associated with chest compression and cardiopulmonary resuscitation, the code is M96.A1. Rib fracture, it is M96.A2. Multiple rib fractures, M96.A3. And flail chest, M96.A4. For other fracture, it is M96.A5. What is a flail chest? It may occur when 2, 3 or more ribs are broken at least 2 places and detached from the rib cage. It will create a significant disturbance in respiratory physiology and chest movements. Coming to the examples. Intervertebral annulus fibrosus defect of large lumbosacral region. Here the codes are classified based on the size of the defect and the region. Here the region is lumbosacral and the defect size is large. The code is M51.A5. Intervertebral annular fibrosus defect, large lumbosacral region. Next, patient has muzzle wasting and atrophy of the cervical region. It is a direct code, that is M62.5A0, muzzle wasting and atrophy, not elsewhere classified, back cervical. Coming to the next example. The patient admitted for non-traumatic acute and chronic unstable slipped femoral epiphysis of the left hip. The code is M53.052. Here the acute and chronic and unstable slip and the laterality is left hip. The code is M53.052. Acute and chronic slipped upper femoral epiphysis, unstable left hip. The next example is the patient admitted for multiple rib fractures associated with chest compression and cardiopulmonary resuscitation. The code is M96.A3. Multiple fractures associated with of the ribs associated with chest compression, cardiopulmonary resuscitation. Coming to the summary. The new codes have been added for intervertebral annulus fibrosus defects of lumbar and lumbosacral region, M51.AX. X indicates whether it is a lumbar or lumbosacral region and whether it is a large or small size of the defect. Next one is revision of slipped upper femoral epiphysis codes to include the stability and laterality of the slip, and the new codes is M93.0XX. The new codes have been added for muzzle wasting and atrophy of the back, that is M62.5AX. The new codes for the chest fractures associated with chest compression and cardiopulmonary resuscitation, the codes are M96.AX. This is about chapter 13 changes. Keep watching and Please share and subscribe our channel for latest updates. We'll see you in the next video with few more updates.